The face and neck and make our way, I guess, down
Sounds
and
good.
then back. So starting with the face and neck, you have the masseter muscle, large masseter muscle here. This is the muscle that's going to elevate the mandible, which is going to allow you to chew. As we make our way to the neck, the next two muscles that you need to be aware of are going to be the digastric muscles and the mylohyoid. The digastrics are going to make up, or are going to depress the mandible. And so this is going to be the antagonist to the masseter. While the mylohyoid is going to make up the floor of the mouth. As you make your way down to the neck, you're going to have the sternomastoid on the cat. For the humans, this would be the sternocleidomastoid. The action for these guys, for bilateral contraction, you're going to have flexion of the neck. For unilateral contraction, it's going to be rotation of the head. And then, as far as identifying, this would be the sternohyoid. So those are the major muscles that you will need to see in the ventral, face, and neck. As we move down to the chest, the next group of muscles are going to be the muscles of the superficial chest. In this case, we have our landmark cat muscle only, the pectoantebrachialis. As we go deep to that one, you're going to see the pectoralis major and then the pectoralis minor. And then again, just for identification and kind of landmark purposes, the xiphi humoralis on the cat. So it's cat specific. So the two we're concerned with then for humans are going to be the pectoralis major and pectoralis minor. Now for the pectoralis major, the main action is going to be to medially rotate the humerus. And for the pectoralis minor, this is going to rotate the scapula and kind of protract the shoulder for that minor. As we make our way down to the abdomen, there's going to be four muscles here that you should be aware of. The most superficial is going to be the external oblique, and you can see the fibers running in this direction. The action for the oblique is going to be to rotate the trunk. Rotates the trunk. As we go deep to that guy, we're going to see the parallel muscles here, the rectus abdominis. And for the rectus abdominis, the action is going to be to flex the trunk. As we go to the deeper muscles, you have a good view of the internal obliques here. And they're also going to rotate the trunk, as well as compress the viscera. And then finally, the last layer of muscle here is going to be the transverse abdominis, which in this case, they're going to compress the viscera. And since we're already here and it's kind of visible, not too visible, but enough for you to get an idea, these are going to be the external intercostals. So you get a good view of the external intercostals there. Now as we make our way anterior, you would see a border with the internal intercostals. So that
serratus muscle is going to be on there?
Yeah. We'll get to those guys a little bit deeper. But these would be the external intercostals, and again, as you make your way more anterior, you would see that border with the internal intercostals. So those are going to be the muscles there. Moving down to the leg, starting with the superficial muscles that we had. Initially covering all of the muscle groups here, you had the sartorius, the band-like sartorius, and the gracilis on the medial aspect. Now for the sartorius, this is going to allow you to laterally rotate the knee or abduct the knee, as well as bend the knee. And the gracilis is going to help with knee flexion as well. So those are the superficial muscles. As we go deep to the sartorius, you're going to see the quadriceps group. In the quadriceps group, you have the rectus femoris, the vastus medialis, vastus lateralis, and deep to the rectus femoris, the vastus intermedius. Now these guys as a group are going to extend the knee and flex the thigh for the quadriceps. Lateral to the quadriceps, you see the tensor interfascial lata muscle, and the IT band in this case is mainly missing, right? So you don't see it anymore there. But that would be that small muscle. Coming back to the medial aspect, you would have the adductors of the thigh. And now in the cat, you have the adductor femoris here, which is a large muscle that is not going to be present in humans. In humans, we would have the adductor magnus. The muscles that are also present in humans that are present here will be the adductor longus and the pectineus, slightly deeper. So these would be adductors of the thigh. Then for the deep muscle here, you have the iliopsoas. The iliopsoas lateral to the blood vessels and nerve. So it's the iliopsoas. Continuing down to the lower leg. Let's see, where's the good dissection here? So initially you're going to see the tibialis anterior, which is this muscle here. The tibialis anterior is going to dorsiflex the foot. Lateral to that, you're going to have the extensor digitorum right there, which is going to extend the digits of the feet. The fibularis longus. And then as you continue now to the dorsal muscles, the soleus and the gastrocnemius, which in both cases the soleus and gastrocnemius would plantar flex the foot. So these would be antagonists to the tibialis anterior and vice versa.
Which is the prime mover of those two?
It really depends on what type of activity you're doing, right? And this gets back to the fibers that we talked about yesterday. So usually for sustained activities, it's going to be the soleus, and for quick bursts, the gastrocnemius. So those would be the muscles of the entire crural region. Going back to the posterior thigh now. This is where we're really going to see the hamstring group. In this case, these are kind of clearest. We might have to swap cats here. The posterior thigh, the hamstring group now, which are going to be the antagonist to the quadriceps group. The large lateral muscle that you're going to see as part of this hamstring group is the biceps femoris. Right? As we make our way medial on the hamstring group, you're going to have the superficial semitendinosus, and then the deeper semimembranosus. Right? So semimembranosus, semitendinosus, biceps femoris. Right? Main action of these guys is going to be to flex the knee. As we make our way up to the glutes, we have a cat-specific muscle here that will kind of function as a landmark, right? The cauda femoralis. Now, as you go cranial to the cauda femoralis, you're going to see the gluteus maximus. You see the border there. Right? Gluteus maximus, and then the gluteus medius. And these are going to be abductors of the thigh. So these would be the antagonists to the adductors that we saw on the medial thigh. Making our way cranially, we didn't dissect it here, but on that cat, we could see it, was the erector spinae groups, deep to this aponeurosis here. So if you see anything pinned in this region, that's what it would be, right? The erector spinae group. And the erector spinae then will be the antagonist to the rectus abdominis, where these guys would extend the spine. Right? Continuing up, the next muscle we're going to see is the latissimus dorsi. And this is going to be the large flap-like muscle on the back here.
I get it now, that's California.
So latissimus dorsi.
I was like, what is that?
Continuing forward to the superficial muscles here, you have the trapezius group, which is going to be along the midline here. The first muscle would be the clavotrapezius, and the acromial trapezius, and spinal trapezius. Now for the trapezius one, the main action I want you guys to remember is mainly going to be from the clavotrapezius, and that's going to be to extend the neck. Right, so if the sternocleidomastoids flex the neck, these guys would extend the neck. So the clavotrapezius would be the antagonist to the sternocleidomastoid. Here's our levator scapulae ventralis, this band-like muscle that's going to elevate the scapula. Now as we go lateral to this, you're going to see the deltoids, right? The clavodeltoid, the acromiodeltoid, and the spinal deltoid, which is this band here. Now the main action for the deltoids is going to be to abduct the arm. For the muscles of the deep back, you're going to see, the rhomboideus major muscles here. And as we make our way cranially, you'll see the rhomboideus minors. These, if you just generally say rhomboideus muscles, you'll be fine.
Oh, so we don't have to say major, minor, and capitis?
Well, the capitis you do, but not for the major and the minor.
These are
It's hard to kind of distinguish. The rhomboideus capitis is this large visible band here making its way to the cranial region. And then deep to that, you have the splenius. Right, the splenius, which is going to also extend the neck along with the clavotrapezius. The deep muscle to the acromiotrapezius is going to be the supraspinatus. And then from this angle, now we're under the scapula, you see the subscapularis. So we go to the deep chest here. So we reflect the latissimus dorsi. This would be the spine of the scapula. So this muscle here, large visible muscle on the scapula, would be the infraspinatus. And there's a border here where you would see at the edge of the scapula the teres major. And there's another border here where you do see the rhomboideus majors. Now if it's pinned here, you do have to say rhomboideus major, right? Because that's for sure what it is. So rhomboideus major, infraspinatus, teres major.
That wasn't lying.
Then you have the serratus ventralis. These muscles here. Very nice view again of the external intercostals. And then you have the scalenes in this area. So those would be the main muscles of the deep chest. Now we can go to the muscles of the brachium. And the first muscles we're going to see are the clavodeltoid, clavobrachialis, and the epitrochlearis, which the epitrochlearis in this case would be cat specific. So we're just going to reflect that guy and go to the deeper muscles here, which you have the biceps brachii. It's going to be a synergist for elbow flexion. As we go deep to the blood vessels and nerves, you see the medial head of the triceps brachii and the long head of the triceps brachii. And now we're quickly going to go to the dorsal side to see the long head again. And at the border here, now you see the lateral head of the triceps brachii. These muscles are going to extend the elbow, so they would be an antagonist to the biceps brachii as well as an antagonist to the brachialis muscle. The brachialis is going to be the prime mover in elbow flexion. So those are the major muscles of the brachium. Now as we move to the antebrachium, you have the brachioradialis, which the brachioradialis technically is going to be a flexor of the elbow, another synergist for elbow flexion. And now you're going to have the extensors of the antebrachium, starting with the extensor carpi radialis longus, right, extensor carpi radialis brevis, extensor digitorium communis, which would extend the digits, extensor digitorium lateralis, and then the extensor carpi ulnaris. And as the name implies, obviously these are going to extend the wrists or the digits. Now in the human, keep in mind the extensor digitorium communis is just extensor digitorium, and the extensor digitorium lateralis would be the extensor digiti minimi. The others are named the same. As we go to the ventral forearm, the first muscle we're going to see is the landmark muscle, the palmaris longus, which in humans is not that large, right? It's actually a lot smaller in humans, but for cats this would be our landmark. So palmaris longus. If we move in this direction, we're going to see the flexor carpi radialis, and then the pronator teres. This little muscle right there. Pronator teres, flexor carpi radialis, palmaris longus, and at the very lateral side you have the flexor carpi ulnaris. Of course, in this case, these are all going to flex the wrist. And that's it.
Wait. So in humans,